Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And I'm here today with Dr. Michael Narvey for the presentation that he is going to hold at our Gold Neonatal Online Conference. Welcome.
Hi, thanks for having me.
It's wonderful to have you back. You've been back by popular demand here at Gold, so it's fantastic to have you back here with a brand new topic. And you're actually presenting twice at this conference, so thank you so much for that. In this little interview, we're going to talk about your presentation that is titled The Return of RSV in the NICU, New Management and Mitigation Strategies. Before we jump into that, can you tell us a little bit about you, where you are in the world, and about your professional background?
Oh, sure. So I'm in Winnipeg, Manitoba, Canada, and I've been a neonatologist since 2004. So it's hard to believe 20 years have gone by. I've spent a lot of time in leadership. So I've been the section head, or what some people would call division head, of the neonatal intensive care unit here in Winnipeg for the last 14 years. Aside from working in neonatal care, I'm very interested in all sorts of different things, including presentations such as this, doing social media, and fostering educational opportunities in that forum to try to spread knowledge and improve newborn care throughout the world.
Fantastic. Yeah, education is so important, right? Nowadays, with social media and platforms like this, you are able to reach a much broader audience as well. You mentioned that you've been in neonatology for like 20 years now, and I would like to know, probably a lot has changed when you first started out, right?
Oh, tremendously. Although, like a pendulum, things tend to swing back and forth. And although not the topic that I'm going to be talking about, when I think about a hot topic, which has always been, what do we do for our smallest babies, those born at 22 to 24 weeks? When I think about the things that we were doing 20 years ago that fell out of favor, many of those things are starting to come back. And so much like a pendulum, we see things, as research grows, the pendulum swings. And here we are in many ways back to where we started.
That's fascinating to me. We always would assume technology changes, we're advancing, and that pendulum now is going to. I find it fascinating. I find it very interesting what you mentioned there as well. Also some fantastic going back also to basics, almost like we see a lot about now: nurture science, skin to skin, kangaroo care. Obviously. Human milk in the NICU. I mean, all these things are so very important.
Yeah, in fact, I'm glad you mentioned that because, of course, being a midwife yourself, I think you have obviously a great interest in things like skin-to-skin care, breastfeeding promotion. And in fact, I was just presenting somewhere else and talking about a recent study that came out, which I think would be of great interest to those who are following Gold, which had to do with management of hypoglycemia with a combination of skin-to-skin care and breastfeeding. And what they found in that study was just something like going back to nature, skin-to-skin care, breastfeeding led to significant reductions in the risk of a low blood sugar at 2 and 4 hours in at-risk babies. So, thinking back to what I said earlier about the most vulnerable, tiniest babies and how we're sort of the pendulum is swinging, we often reach for that shiny new object. We're always drawn to it. But sometimes the answer, to some of the ailments that we are dealing with is actually right back to bread and butter. It's right back to the basics of newborn care. And some of the things that were always there, if we just really push for those things, can make a big difference to our babies.
Love hearing that. Oh, now let's talk about your topic here, the return of RSV in the NICU, new management and mitigation strategies. RSV, I mean, that is a big topic here. And and even for people who are not necessarily working in the NICU in recent years, especially after COVID, we heard a lot. There was a lot in the media about RSV and the return, also for newborns, small children, and especially in the NICU. So talk to me a little bit about that.
Yeah, I think what you just said is spot on, that, RSV, as those of us who work in the field know, it comes through every year, typically from
Mhm.
around November through possibly around this time, April, early May. And it rears its ugly head in North America every year. But it's probably one of the conditions that is so common that many people had never heard of. For reasons that I'm not quite clear on, it really made a big splash in the media this year. So I think that, whether you may not know much about what a neonatologist does, but you certainly would have to have almost been under a rock through the 6-month winter period, and not have heard about all the goings on with RSV. And in
Mhm.
fact, when I think about, even in casual conversation, with friends or family, interestingly, the topic of RSV started to come up. So I think there's been a great increase in public awareness about it. And what I'm hoping to do is provide some further education to people so that they better understand what it is that RSV does,
Mhm.
especially to our preterm babies, our at-risk babies, and why we really need to think about strategies to mitigate that risk.
Mhm. I can imagine there are specific challenges, especially in the NICU, for managing RSV. Can you just briefly talk about that as well?
Yeah, so we desperately try to avoid having RSV patients in the NICU. It does happen though. There are situations where we have our PICU or PICU, the pediatric intensive care unit, may become overwhelmed, too many patients. And so sometimes even in our own center, we've had to take in babies who we would otherwise not have in the NICU. The reason we try not to have them in the NICU is RSV or respiratory syncytial virus, for those that don't know, is a highly contagious virus. And so when you've got, little premature infants on ventilators, having a baby close by with RSV is dangerous. And now, you can further mitigate that risk with things like single patient rooms, which gives us some degree of comfort that we have, droplet precautions present with the babies being further away and walls in between them. But when you've got one nurse, perhaps, maybe you're short-staffed, maybe you've got multiple assignments. If you have one nurse caring for multiple babies,
Mm.
that can create a real issue,
Yeah.
where, we certainly expect excellent hand washing, but if there's any breaks, it would be very easy to transmit RSV from one baby to another.
Yeah. Oh, such an important message right there, and also what does that mean for, we talk a lot now in family integration in the NICU. I guess there's also needs to be a lot of education for family members and parents in that scenario as well, right?
Oh yeah, during the RSV season, at least here in Winnipeg, we started to bring back masking, which we all remember from
Yeah.
COVID. So we really, in the patient care areas, we masked throughout the RSV season. Mind you, we didn't have parents masked, but the health care practitioners all masked, and we were really trying to mitigate that risk.
Mhm.
And one of the things that we really insist upon is the washing of the hands. That is the most important thing. And secondly, to use common sense. If there's anything we learned during COVID is if you're sick, stay away. Now,
Right.
if you are a breastfeeding mother, that's more difficult. But if you're going to be present, make sure you wash your hands and wear a mask if you're sick.
Mhm.
And lastly, I'll say, because we saw this again during COVID, it was amazing to me how many people during COVID suddenly had allergies. You would often hear, no, 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 it's not COVID, it's not a cold, I have allergies. And I think, because people were getting fed up, with
Mhm.
having to restrict and so forth. But I think we have to be honest, because at the end of the day, what it's really about is protecting the infants and
Absolutely.
not being worried about inconveniences to ourselves.
Absolutely. Now, in your title of the presentation, you're talking about new management of and new and mitigation strategies. I'm sure you're not talking about that shiny new object that we talked about earlier, right, with the pendulum. So tell me just briefly
Sure.
about what's new here.
So, the talk will go through what, we'll look at the evidence behind the current evidence behind what we think works in the patients with bronchiolitis and what doesn't work.
Mhm.
But the other thing that we're going to talk about is nirsevimab. That's a mouthful, I know, But for many, many years, we've been dealing with a vaccine called palivizumab, otherwise known as Synagis. And so we have a new kid on the block. Now, you said that shiny new thing. This is the shiny new thing. But what I'm going to go through in the talk is I'm going to show people why there are benefits to using the new vaccine. And, I think by the end of the talk, people will be enlightened as to some of the ways in which this may be a superior choice, and that we'll see what the future will hold.
Well, thank you so very much, Dr. Michael Narvey, for sitting down here with me, talking about management mitigation strategies of RSV in the NICU and about the wonderful work you're doing in your community. Thank you so much.
Oh, you're very welcome.
And for our viewers now, some information. If you are curious now about this presentation and all the other presentations in our Gold Neonatal online conference, we invite you to go to goldneonatal.com. You'll find information about the presentations and, about our speakers as well. So please join us there, and we hope to see everyone at the conference. Bye-bye for now, everyone.
Bye-bye.